Dr. Marc Serret from Fox Valley Plastic Surgery is here to talk about migraine relief surgery, and he brought along one of his patients, Cindy Schlecker. Good morning to both of you guys.
Thank you for having us.
You betcha. So obviously you do more than just plastic surgery. Tell us about this migraine relief surgery.
Sure, absolutely. It's a new field in migraine surgery, in plastic surgery rather. It's been around for the past decade. It's been very well studied over the past decade, doing multiple trials through the great work that the person I learned the procedure from, Dr. Gyron in Cleveland. And it's a field that really focuses in on patients trying to do a lot of listening. As a doctor, I always found that it's very important to listen to my patients and try to identify where they're telling me their migraine headaches start from. By being able to identify that starting site, we are able to devise a treatment plan for them that is focused on minimally invasive surgery, outpatient. It's very far removed from being brain surgery. It's actually removing areas of compression that are causing pain to these nerves that are setting up years and years of chronic pain for patients like Cindy and for other patients. And what we're doing is we're relieving that compression and then subsequently helping them gain control of their lives back.
Well, and I guess what I meant to say is that I think when people think of plastic surgery, they think of more of a cosmetic thing, and they wouldn't think of, really for migraine? It's
Absolutely.
kind of like, wow. So Cindy, tell us your story. You've been suffering from migraines for a long time?
They started in January of 2008, and actually I fell down and got a concussion, but after the concussion was over, I still continued to have them, and I searched every doctor that you can possibly imagine: osteopath, chiropractor, acupuncture, dentist, eye doctor, ear doctor.
Nothing was working.
Nothing.
Yep.
Nothing was working. My husband saw an ad in the Fox Cities magazine for Dr. Surrett, wrote him a letter unbeknownst to me, and they called me and said, come in. I had my surgery in September. I went in with a headache. The first words I said when I came out of anesthesia was, my headache's gone.
Wow. Wow. So what do you guys do? How does this all work?
What we're doing is we're focusing in on where Cindy or any patient that I see's pain is stemming from. Very much like if you had a fire, never in your kitchen, of course, Amy, but if you had a fire in your kitchen, you don't do any real success by trying to extinguish the whole kitchen. You have to find the igniting source.
Sure.
So what we're doing is we're finding the igniting source in a migraine sufferer, and then very similar to procedures like carpal tunnel that we know very well, where nerves can be trapped and they can be squished on literally, we're relieving that pain by decompressing the nerves.
Wow.
And that's something that I do surgically.
I know so many people that suffer from migraines, and it's awful to see them. It's just, they turn into a different person. It's
Absolutely.
just so painful. It's just, how do you know if you would be the candidate? Obviously, come in and see you. And what's the downtime on this?
It's short downtime, and Cindy can elaborate a little bit on that. I mean, it's geared as outpatient surgery. It's the type of surgery that really just takes a few hours to get your life back.
Wow.
It's patients that are in and out of ERs that are frequently bothered with multiple medications, and Cindy certainly can attest to improvement of that. I'm very proud of her and happy that she's doing well.
She looks fantastic.
As all my patients,
yeah.
So
That's great.
it's something that has short downtime but big effect.
Big smile over there. Real quick, you've got a seminar coming up for people who want to find out more about this. It's December 11th. Tell us more about that.
Yes, I frequently do seminars because I realize that the last thing we need to do in an economy where healthcare dollars are very expensive, we need to learn about things before we're actually going to approach them.
Sure.
And I realize this is a new field to Wisconsin, but obviously not a new field nationally. So what I try to do is I try to do a little bit of outreach to talk to patients, in a very low-key setting where you can ask all the questions you want, and it's basically a free consult, if you will. We try not to obviously, get into too many exact patient details per patient there,
Sure.
but we certainly demystify the entire field. It's meant for patients. It's not meant to be very technical. It's meant to really educate.
All right, so it's December 11th from 6 to 7 o'clock at Appleton Medical Center. You can call to register 800-236-2236. For more information, you can also give Fox Valley Plastic Surgery a call. Doctor, thank you so much for coming.
Thank you for having me.
And Cindy, thanks so much for sharing your story. Appreciate
Thanks
it.
for having me here.
What a great new thing. Really appreciate it.
Got my life back.
Well, that's awesome.